Welcome back to my YouTube channel. I'm Nitin Naik. Today I'm going to discuss about COVID-19. So today we are going to talk the COVID. What is COVID-19? The common signs of infection, how this infection can cause, prevention and treatment for infection. So, what is a COVID 19? COVID 19 is the infectious disease caused by the most recently discovered coronavirus. In the previous talk, I discussed that what is a coronavirus, what is its classification, what is its structure. Okay, so this novel coronavirus or nCoV or SARS coronavirus 2 is the main cause for COVID-19 disease. So CO for corona, VI for virus, D for disease. 19 is the year in which this outbreak is there. This new virus and disease were unknown before the outbreak, which began in Wuhan, China in December 2019. It is now called as pandemic because it has spread across the globe. More than 210 countries are being affected by this coronavirus. So the common signs of infection includes the reported illnesses have ranged from mild symptoms to severe illnesses and even death for confirmed coronavirus disease 19 cases. Following symptoms may appear within 2 to 14 days after exposure, and there are some cases even they are reported up to 24 days also. But this is the general period in between the following symptoms, that is respiratory syndromes, that is fever, that is cough, shortness of breath and breathing difficulties. So these are the different types of symptoms it appear they may supposed to be the infection of coronavirus. So whatever infection we have studied, that infection can cause pneumonia, can cause severe acute respiratory syndrome, that is SARS, or kidney failure, or even sometimes they lead to the death. So the recommendation for the prevention and treatment of infection includes standard recommendation to prevent infection spread include regular hand washing. You have to wash your hand regularly. You have to cover your mouth and nose when you are coughing and sneezing. You have thoroughly cook the meat and egg. You have to avoid the contact with anyone which showing the symptoms of respiratory illnesses such as coughing and sneezing. So these are the preventive measure. Also, you have to avoid the close contact with people who are sick. You have to avoid three T's. Okay, so what is meant by three T's? One is the touching to your eye, second touching to your nose, and touching to your mouth. Okay, so stay at home when you are sick to prevent the spread of infection. Cover your cough or sneeze with tissue and throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces using regular hand wash, cleaning spray or wipe. Then wash your hands often with soap and water for at least 20 seconds, especially before going to bathroom, before eating, and after blowing your nose. After while coughing and sneezing, you have to after coughing and sneezing, you have to wash your hands for at least 20 seconds. The soap should remain in your hand for at least 20 seconds. If the soap and water are not readily available, you can use the alcohol-based sanitizer with at least 60% alcohol in that. Always wash your hand with soap and water if hands are visible dirty. Some people do not develop symptoms, but they are carriers. They may lead to spread the infection to other people who are sick or who have previous medical history. But some people are showing symptoms like fever, cough, shortness of breath, and pneumonia. So the severe lung damage is the main observation in case of coronavirus. Okay, so it leads to the septic shock, and this is observed mostly in people who have more than 60 age, those who are smokers, and those who have previous medical history or conditions. So may this leads to septic shock or even death. So the cough or sneeze spreads the infection. The symptoms for this virus may appear average after 5 days and up to the incubation period 24 days. So within 24 days, okay, there are some reports, but maximum 5 to 14 days, this is the incubation period of this virus. Asymptomatic people can spread disease. The answer of this question is yes. They, even though they are asymptomatic, they are the carriers of virus, and when they come in contact with the healthy person, but that healthy person is having the previous medical history or other things, the virus can spread or can transmit from the healthy or sorry infected person to the normal person. So real-time PCR, that is RT-PCR, is the detective technique for the RNA detection. For this detection, the sputum sample or the swab, nasal swab or the serum from the infected person is taken up for detection of this coronavirus. So there are some treatments, actually not treatments, but they are called as supportive cares, that is providing fluids, providing oxygen or ventilatory support are the care which are taken by the hospitals. Along with that, some clinical trials are also being carried out on this drug, that is chloroquine, ritonavir, remdesivir. They are not the treatments, but they are preventive cares. You have to, if you are suffering with this coronavirus, you should isolate yourself, or you have to keep the distance of at least 6 feet, that is 2 meters, or you can survive. Or also you have to swab or sterilize the surfaces which you are going to use. You don't know who people use that surface before you. You have to prevent or avoid travel to outbreak areas. You have to stay away from crowd. You have to stay 6 feet or 2 meter away from anyone who have showing the symptoms. Prevention, as we have discussed, hand washing, using of surgical mask, avoid touching to eye, nose and mouth, that is T-zone, and also for healthcare workers, they have to use surgical mask, gloves, long sleeve gowns, eye protection, and the N95 respirator mask. Okay, so this is the same thing which we have to sing. In short, for the prevention, you have to hand wash thoroughly, avoid travel to outbreak areas, stay away from the crowd, avoid touching the T-zone using protective equipments. So this is all about the COVID-19, its cause, spread, infection, and treatment, and also preventive care. If you like the video, please click on a like button. Don't forget to share with your friends, and till you are not subscribed my YouTube channel, subscribe by searching this name. Thank you.